So let's start with today's meeting. We have this panel of advisors to the CDC, and they are going to be determining how to allocate the initial supplies of this vaccine.
So first is, let's talk about who these people are. The ACIP, or the Advisory Council for Immunization Practices, has been in existence for many, many years. It is their practice, their routine practice, to review all of the recommendations from the FDA and actually tell everyone else, this vaccine that you approved, how should it be used, who should get it, how often they should get it, and how it should be distributed. So they've actually been doing this job for years and years and are very familiar with how to get vaccine out and who to get it to. They're looking at the vaccine and they're trying to decide who gets it in the first wave, the second, and the third. And while these are very important discussions, I want to tell everyone, take a step back and remind everyone that even with those discussions going on, we still won't have enough vaccine for all of the waves of the people that they recommend it should be used for. That's not going to happen for several months. So while you may be in the wave 1 or the wave 2, you may not actually be able to get access to a vaccine immediately, even though you are allowed to.
And let's talk about what those, as you're calling them, waves, so I'm going to go with that, what those kind of, delineations will look like. We heard from public health officials, medical experts. They said, healthcare workers should get it first, and then followed by possibly vulnerable Americans, so the elderly or people with pre-existing conditions. But, this is ultimately up to the states to decide whether or not they're going to follow what the CDC, guidelines, what they come up with.
Right, it's going to depend on not only the state, but how to get it to those people that are in that wave. So for example, healthcare workers, they're pretty easy. We know who they are. They're working in a hospital. They'll have access pretty easily, especially if it's the Pfizer vaccine, which has to be kept at minus 70 degrees. So every hospital has those kind of freezers and has a plan how to roll it out. On the other hand, when you think about nursing home patients, nursing homes don't have those kind of freezers, and more importantly, their population is not mobile. They can't get in a car and drive to your local pharmacy, line up and get a shot. So it's going to be hard to think about how we're going to have them access. The next group of people that we want to have access may be first responders. But who's a first responder? Is it police, firemen? Is it EMTs? Is it teachers? Who are those next group of responders? Sanitation. It depends on who they are, how are they going to have access to the vaccine, how we're going to get it to them, and more importantly, to track. Remember, these two vaccines both need 2 doses, and you can't mix and match the doses. So you can't get a dose of one product and then say, I need dose 2, and go someplace else and get dose 2, but it's a different product. It's going to be very important to keep track of what your dose is, the first one, and the second dose, in the time frame which it was set up with the clinical trial. So you can't get dose 1 and then 3 months later get dose 2. You have to get it within 21 to 28 days.